Good afternoon, everyone. My name is Carrie Wood. I'm co-chair of the Insurance and Real Estate Committee, and I'm here proudly with a coalition to support small business health insurance plans. I'll never forget the story of a CFO of a credit union telling me he has a $17,000 high deductible plan. He's literally one medical condition away from not being able to pay his mortgage. I'll never forget the story of a woman in the nonprofit community making $53,000 a year with a $5,500 high deductible plan. These people are basically acting like they're uninsured. They're not going to the doctor. They're not able to take care of their kids. So this coalition here is forming a new option of plans for small businesses, plans that are unique and affordable, and that will help create more competition in the market. And I'm so glad to see all of them here today. With that, I'll introduce Ranking Member in the Senate, Senator Tony Wong.
Thank you, Madam Chair. It's great to see the crowd out here because you have reinforced what we thought in the committee, that this is an important issue. It affects our small businesses, which are the engine of our economy in the state of Connecticut. But it's also affecting people's lives. And talking about affordability in Connecticut has been a primary issue for us in the Senate Republican, but health insurance cost is prohibitive. And particularly for our small businesses in the very challenging small business marketplace, where we've seen Connecticut Care exit out of the business, we have come up with a solution that parlays and combines the best of what Connecticut has to offer, which are innovative small businesses and their affiliate members, to be able to create a lower cost health insurance program. I know it sounds pretty amazing, and you say, why haven't we done this before? But it is a different type of thinking in a bipartisan, bicameral result of working together to find these solutions. So for me, I'm thrilled to be a part of this, but also equally important to see the strong interest that we have seen throughout the state, that people in their businesses can afford to buy insurance for themselves and their value employees to help grow businesses and keep jobs. So I'm going to introduce the ranking member, House member, Cara Pavelak-D'Amato.
Thank you very much. Every election cycle, we see legislators sending out mailers touting their pro-business stance. Every year also, during election cycle, we also do a lot of doors and hear from constituents that health insurance is the most important issue to most people and the unaffordability of that health insurance. Well, now is the chance for us to come together and to make a difference. We need to stand behind those campaign promises and pass this bill that will expand and make health insurance more affordable for small businesses across the state. I am so glad to see such a great turnout today, and it just shows you how important this issue is to not only us, but also to our constituents. So I am looking forward to having the help of the insurance department and everybody else with getting this program passed. So thank you.
So good afternoon, everybody. I'm Chris DiPentima, the president and CEO of the Connecticut Business and Industry Association. CBI has thousands of members across the state of Connecticut in every industry sector, and 93% of our membership is under 100 employees. And I want to thank Rep. Wood, Senator Wong, Rep. Pavelak-D'Amato, as well as all the other policymakers up here. This is a big group, but also the businesses and the trade associations that are up here. There's probably as many people behind me as there are in front of us, and this is a big issue for us in Connecticut. And it's great to see this bipartisanship that's happening in order to create an innovative solution to address a challenge that we've had in Connecticut for such a long time. That's the cost of health insurance for our employers and their employees. And let me give you a little bit of a different perspective on what this means. It's not only a cost issue, but it's addressing our workforce crisis, a crisis in Connecticut that is crippling our economy, a crisis in Connecticut that right now we have 100,000 job openings in our state. In fact, if every unemployed person got a job today, if we had 0% unemployment, we'd still have more than 20,000 job openings in the state of Connecticut. We need solutions to make it easier for our small businesses to find and keep workers. We need solutions that attract more people to Connecticut and keep more people in our state. And one thing that we've certainly learned over the last decade is that Connecticut's workforce does not grow unless our population does. And our population does not grow unless our state's affordable. And that affordability comes in many ways. The cost of housing, taxes, and certainly the cost of health insurance for our employers and their employees. So this bill helps our small businesses attract talent, giving them the ability to band together to provide quality, affordable health insurance benefits to their employees, our residents in Connecticut. So CBI is a very proud partner of this bill and very proud supporter of this bill. Now it's my pleasure to introduce Bruce Adams, the President and CEO of the Connecticut Credit Union League.
Good morning or afternoon. I am Bruce Adams. I'm the president of the Credit Union League of Connecticut. And credit unions are unique businesses. We're cooperatives. And so that means that we're owned and controlled and governed by the people who use our services. And that makes a unique benefit in this state in that the profits that we make, if any, are returned to those customers, those members, in the form of advantageous rates on loans and deposits. And because we pay those profits back to those people, that money stays here in the community. Association health plans allow a credit union to divert that money back into the pockets of their members themselves. It is not simply an issue of getting better care or getting better coverage. It is a workforce issue. It allows our credit unions to compete in the marketplace against much larger financial institutions. We want to grow, we want to hire people in Connecticut, and we want to be able to compete in that marketplace. But also, we want to be able to provide solid, good care that's fully regulated by the insurance department, that protects essential health benefits and all those mandated coverages. Credit unions, if we went for a plan that didn't hit those marks, frankly, it would be very off-brand for us. We're the original community partners, and we want to help our employees attain health. We want to help our communities attain health, and I'm proud to be a supporter of this legislation. Thank you.
Good afternoon. My name is Deborah Cavanis, and I'm the president of the Southern Connecticut Black Chamber of Commerce. This critical piece of legislation is critical to the survival of the small businesses that I represent, who continually struggle with the affordability cost of health insurance. Small businesses and groups have little or no negotiating power when it comes to price and benefits, as opposed to the larger employers, who have the buying power and the scale to negotiate better prices, plan designs, and services. Having fewer than 50 employees should not be a barrier to access to affordable health insurance. I'm also here representing the nonprofit organizations. I'm the president and CEO of a local training program in Bridgeport, Connecticut, and my partner is in New London, Connecticut. And both nonprofits struggle with the cost of providing health insurance to our employees. And the commonality that we have between the small businesses and the nonprofits, that if we're not able to provide affordable, low-cost health insurance to our employees, that results in us not being able to retain a skilled workforce, which can negatively impact our economy. I'd like to commend State Representative Woods and the other elected officials here today for your leadership, for your vision, and for not forgetting the little guy, the small guy who needs your help and needs your assistance. So please know that we are in full support of this bill, and if there's anything that we can do to make sure that it moves forward, we are here. Thank you.
Good afternoon, everybody. Scott Dolch, President and CEO of the Connecticut Restaurant Association. I'm just really glad to be here with all of these legislators behind me. This is a really important piece of legislation for all small businesses in Connecticut, but especially as I've had many conversations with people behind me about the importance of health insurance and healthcare for my industry. When you talk about the hospitality industry and restaurants specifically, a lot of owners over the last 2.5 years have been struggling to keep, and we talk about, as Chris mentioned, workforce development and how important it is to keep and retain great staff. And it's not always just about pay, it's also those benefits that are there. And to have a competitive opportunity with healthcare plans for a small restaurant that maybe has 20 or 30 employees, right now they don't have that buying power and their rates are just way too much for an owner to take on. So an opportunity like this, and obviously as I work with the National Restaurant Association, there actually is a national trust that is out there that we've seen states benefit from this across the board. And we hope that this piece of legislation can get across the finish line and allow us in Connecticut to do the same thing. So thank you again for the time, and thank you to these leaders behind me for putting this piece of legislation together.
Good morning or good afternoon. I'm John Carl Casa, President and CEO of the Connecticut Community Nonprofit Alliance. Nonprofits come in all sizes. Some have many employees, some have one employee. Nonprofits have all, as you've heard me talk about before, have dealt with the fact that they have fallen 46% behind in buying power since 2007, and they have lost 16% of their buying power in just the last 2 years. They've dealt with inflation, they've dealt with COVID, they've dealt with increased demand for services and programs. And now, like others, they're dealing with the workforce crisis. If they cannot retain and attract new employees, they can't have programs. They can't have services. And the losers, if that happens, are the people of Connecticut. It affects the quality of life of the state. They need options for good, more affordable, high-quality health care. And this proposal holds out the possibility that there will at least be that option out there, that the option will be there for them to have the same kind of programs, the same kind of health plans as larger organizations do. Nonprofits need this, and we support the legislation wholeheartedly. Thank you.
Hi, I'm Bryce Chenault, the Director of External Affairs at Yankee Institute, a nonprofit public policy organization here in Hartford. It's great to echo everything that everyone has said here previously. It's especially great for me to be here. Senator Wand actually represents me in Newtown, and Representative Wood was one of the first legislators I met when I moved here to Connecticut when she ran the Certificate of Need Task Force meeting this summer, a topic I hope to talk about more as well. Yankee Institute supports this legislation because it provides our small businesses the same opportunity to benefit from economies of scale that large businesses do. Small businesses are especially harmed, as has been said here, by the pandemic. And this is something that they need because in many ways they're the backbone of our economy. Small businesses demonstrate the American entrepreneurial can-do spirit every day, and Yankee Institute wants to see them succeed and thrive here in Connecticut. Thank you.
Great. I just want it to be noted that we have legislators of all backgrounds from all different parts of the state, Senate and House members here, up part of this coalition. So with that, we'd like to open it up for questions. Sure. Sorry, we have the Brewers Association.
Sorry, my name is Rachel Diamond, and I'm from the Connecticut Brewers Association. I also have a home-based brewery that I brew out of, which is Broken Symmetry in Bethel, Connecticut. And I'm here today as, just really proud and humbled to speak on behalf of 120 breweries here in the state. I know at our brewery, we employ about 20 to 25 people, and they wake up every morning and they come in with creativity and ideas and vigor and gusto and dedication, and they take care of us, and we would love to be able to take care of them. And that is truly why I feel this is an important piece of legislation. I think we're not unique. Every brewery in the state feels this way. We would love to take care of our employees in an affordable, effective way going forward. And thank you. Thank you to everybody here, because you've really done a wonderful job putting this together. So thank you very much.
Okay, great. We will open it up to questions.
I apologize for getting in the weeds here, but we have to get in the weeds with this topic because it is so complex. That the bill would allow participants in health plans to raise rates on the business that had a sick or injured person. And I want to just make sure I ask you about that. That's one of the big concerns we have.
That's a great question, and that's happening now. But the ability to be able to pool risk instead of having 5 members of a small group, if you form an association health plan, you may have 200 members, 1,000 members, 5,000 members. So the ability to pool that risk and spread that risk out over those many members is what we're looking to do here. Also, when you have the ability to have that many members, you're also buying the stop loss insurance and other things that these insurers are doing in order to make sure that risk is mitigated. It also allows you to make a unique plan so that you're working with your members every year. So if you do have members, say, that are having birth, you can focus your plan and tailor that plan to put more of the resources into that. Maybe you have an aging population where you're dealing with a lot of members with cancer. You're able to tailor that plan for the members with different needs. But right now there are very little options in the market. There are small businesses that are going on the exchange or they're buying private plans. What this does is opens up the options for these small groups, and opening up competition, we all know, will create competition across the market and even help lower costs in some of these plans that are in existence today. Remember that Connecticut recently left the small group market. Last year, we had Harvard Pilgrim leave the small group market. What are we saying to these small businesses with so few options left? This is what we have to do, is think outside the box. Other states are doing it. Other states are doing it successfully, and we want to be able to model this legislation so that it's successful here in Connecticut. Any other questions?
The governor this morning had a press conference related to the overall topic of lowering costs of healthcare with some other proposals. One of those bills, I believe, is going to be in committee hearing potentially in a couple hours, depending on internet situation. So any kind of comment or reaction to them, I guess the general topic of it seems like this legislative session, there's a lot of ways, strategies of tackling the kind of overall cost of lowering healthcare from various different angles.
Yeah, we're in line with the governor on looking at lots of ways to lower healthcare costs. We're also working with the Office of Health Strategies on this topic. We're working with the Department of Insurance. There's no one silver bullet. There's lots of things our committee is doing. We're looking at reducing the assessment to plans on the exchange, which would lower cost to people who are purchasing on the exchange. We're looking at contracts via anti-steering, anti-tiering negotiation. We're looking at site of service. All of these things combined are working together to lower the cost of healthcare, which in turn is the cost of health insurance. So the committee is working on a holistic effect with the governor's bills, with public health bills, with human services bills in order to lower costs.
And I can offer a Republican perspective in the sense that I agree with the governor in the sense that he agrees that healthcare insurance is not affordable and something needs to be done. And this group behind us, advocates and legislators, all agree that something needs to be done. This is one small part toward that solution. Other parts are looking at benchmarking, to expand the benchmarking that was passed through the legislature, to look at our hospitals, to look at our pharmaceuticals, to use benchmarking as a data point to understand why the costs are. We've had a number of cost driver forums to really understand what the issues are and hopefully hone down on it. We're looking at reinsurance, which has been a product that's been utilized in insurance products throughout the country to be able to reduce costs. In fact, the exchange crafted a study about 2 years ago that from the Wakely report that said reinsurance had a substantive reduction in cost of insurance. Why are we not doing it? I don't know. Maybe we should explore that. I know the Senate Republicans have proposed that. I think the most important thing is to understand we can't do nothing. And what we're initiating here is to look at solutions that drives down cost. But we have to understand that the cost of insurance in healthcare is an entire ecosystem. It's not just one. This is a small part of that solution, but ultimately we need to look at our pharmaceutical benefit management. We need to look at our hospitals. We need to look at tort reform. It's the whole gamut of healthcare costs. But this program today, in a bicameral and bipartisan basis, is a small step to help our small businesses and their employees. And as Chris mentioned, workforce development is critical to creating a bigger pie of economic growth for the state of Connecticut.
Any other questions?
Yes, similar to the first one, would this be a block rated program based on the entire block of business, or rather than the individual fund and the insurance?
It is pooling the risk. Yes, it would not be an individual company. It'd be pooling all those companies together. So take, for example, Chamber of Commerce. They could start an association health plan. It wouldn't be a risk based on every individual company, but it would be pooled together. Thank you, everyone, for being here, and we look forward to sharing good news on this bill as we work through the session. Thank you.